Hi everyone, and thank you for checking out another video. Before we get into today's Medical Monday topic, I wanted to give a shout out to a friend who decided to have a courageous conversation with me recently about being more consistent with my podcast. I've struggled with this. I said that this year I wanted to get better with it, and I've had a few excuses for the last few weeks, but as my friend Yvette told me, it is important to be consistent. So even though it is not Monday, I still wanted to do this video and get it posted because I've been meaning to do this video for a few weeks now. And with that being said, our topic is taking medication. Now, I've been taking medication for years and never gave it a second thought. I would just pop a pill, drink some water, gulp it down, go about my day like not a problem until recently. So let me just paint a little bit of a scenery here. Driving into Florida, going through torrential downpour, making it to my friend's house, getting settled in for the night, and taking my vitamins. I took my vitamin. I started choking on my vitamin to the point where my friends tried getting it out various ways. I knew at some point I had dislodged it because I could take some normal breaths, but it felt like it was stuck in the back of my throat. And after like 20 minutes, I realized I wasn't going to be able to go to sleep thinking about, is the pill still in the back of my throat? What's going to happen? What's going on? So my friend took me to the local ER, and the entire staff was amazing. I mean, I was so embarrassed to be at the ER at 11:30 on a Friday night for choking on a vitamin. Like, I felt it was a whole nother low to my life in a way. Okay. But they were so understanding. They explained how this happens very frequently. And as soon as they brought me back into the room, the doctor handed me a can of soda and explained that they keep it on hand because the bubbles and the fizz can lift whatever remnants of the pill that's like possibly still stuck in your throat up and out, which I experienced instantaneously. And then she began to inform me on the correct way to take a pill. And by her version of everything, because I'm not trying to treat or diagnose you, is that when you take the pill and tilt your head back, you open up your windpipe and you make it so it's easier to get things stuck. But she said the correct way is to put the pill and the water liquid you're going to take with it and actually push and tuck your chin in and then gulp. And it feels really weird the first few times that you do it. But after a while, you actually can feel that like the windpipe is kind of like closed. And when you gulp, it's much smoother taking the pill. And also, after my experience at the ER, I mean, it took quite a few days for me to take any of my medications because I was terrified of having it stuck again. So, obviously, this experience has ingrained in my mind no, do it this way. And if that's something you're interested in, I'm just saying you're going to have to practice it because it does feel very weird to do. The doctor shared with me that she got a Benadryl pill stuck. And because of the coating that's on the outside of the Benadryl, there's a reason you're supposed to swallow these medications, not like leave them in your mouth for various reasons. But in this case, it ended up burning the back of her throat. And she said it took her almost a week or so before she was able to like resume normal activity because I had tried to dislodge it. I probably scratched and roughed up my throat more than I would if I had just taken soda and had it done now that I know the trick that they use in the ER. So it took me about 2 to 3 days before my throat felt back to normal. And before discharging me, she said, due to the pain, do I want some lidocaine? Now, I've had lidocaine patches for various reasons, and I know that they use it in some of the injections that they've done, but I've never, had it orally. I've had different tests where I've had to swallow barium, if anybody knows what that is. If you ever had a colonoscopy, various things you have to ingest that taste horrible. All that being said, this lidocaine was, gosh, awful. Like, the nurse brought it in this big plastic syringe. It was all this gel, and she's like, hey, just, discharge it into your mouth, swallow it. And I was like, okay, no problem. I started, it was horrible. I stopped. I looked at my friend. I said, we could just go. I'll deal with the pain. No problem. The nurse, she was like, doctor's orders are for you to take this. If you don't do it, I'm doing it. And then we'll get your discharge papers and you'll get out of here. My friend was like, just do it. I was like, absolutely. So I did. And I'll be honest, when I woke up the next morning, the pain relief that I had gotten was how I was able to sleep that night, because I woke up to some same like very burning, rough pain in my throat. So I am glad that I got it and, in that situation, but I was really surprised that we've come this far with all the technology and something's got to taste like that. Like, seriously? Side note, I go on tangents. But anyway, the whole point is the fact that there is a right way to take medication. And so I just had to share it because I don't want anybody to have to be in the ER for possibly, getting a pill stuck in their throat or in their windpipe. And since everybody on staff at the ER seemed to treat it as a normal occurrence, I know I'm not the only one. So I wanted to make this video and share it with you guys. And thanks for checking it out. And I hope you have a great rest of your day.